Welcome to Have More Babies. We're here to take complex health topics, sort of cut through all the noise, and give you the essential knowledge you need. Okay, so today we're going to unpack this. We're diving into a virus that's often silent, it's incredibly contagious, and frankly, it poses a really serious risk, especially to newborns and young kids. We're talking about hepatitis B. Now, you sent us this fantastic guide, really comprehensive, aimed at busy parents, loads of questions and answers about the infection, the vaccine. Our mission here is to pull out the absolute core insights about this invisible threat and really highlight why prevention, especially right at the beginning, is just key. So let's start with the basics. Just how aggressive, how infectious is this virus, really?
Right, it's essential to understand what we're dealing with. Hepatitis B, or HBV, um, it's a virus that specifically goes after the liver. It causes inflammation, and that can silently progress to lifelong damage, things like cirrhosis, even liver cancer. And here's where it gets, well, frankly, quite alarming regarding how contagious it is. The sources point out that HBV is considered much, much more infectious than HIV. It only takes a tiny, tiny amount of contaminated blood or certain body fluids to pass it on.
Wow. Just hearing that comparison, more infectious than HIV, that's jarring. If it spreads that easily, how tough is this virus? Like, how long can it last outside the body?
It's remarkably hardy. Unlike a lot of viruses that die pretty quickly in the air, the hepatitis B virus can actually survive outside a person for up to 7 full days on surfaces if they're contaminated with blood.
7 days. Just think about that for a second. A countertop, a shared toy, maybe a scrape on the playground. It really underscores why we need to understand how it spreads.
Absolutely. So transmission happens through blood and specific body fluids. For babies, the main worry is mother-to-child transmission during birth. But, later in childhood, it can spread through things like bites or deep scrapes, maybe sharing items at home that might have tiny amounts of blood, think like razors or nail clippers. And then later in life, sexual contact is another route.
Okay, and just to sort of head off some common worries people have with infectious diseases, let's be really clear about what doesn't spread it. We're not talking about just everyday casual contact, right?
That's a really crucial point.
Yeah.
No, it does not spread through casual contact. Things like hugging, coughing, sharing food, using the same utensils, none of that spreads hepatitis B. It needs that direct blood or specific body fluid exposure to get into someone's bloodstream.
Okay. So let's pivot then to why this is so urgent for new parents specifically. I mean, if an adult gets HBV, often their immune system can fight it off. Why are babies at such a, well, catastrophic risk for the chronic kind of infection?
This is really the core reason for the whole vaccine strategy. The difference is just staggering. Up to 90%, 90% of infants infected at birth will go on to develop a lifelong chronic infection. Now compare that to adults. Only about 5% of adults who get infected end up with chronic disease.
90% versus 5%,
Yeah,
that difference is everything. It completely explains why a baby needs protection, like immediately.
exactly. When a baby is exposed, their immune system is still developing. It often just can't mount that strong, coordinated fight needed to clear the virus quickly, so the virus manages to set up shop, permanently in the liver cells before the immune system really gets going. And once it's chronic, it's essentially there for life, often causing damage silently for years.
So given that huge risk, especially the mother-to-child spread during delivery, the prevention has to be instant. What exactly needs to happen in those first, say, 12 hours after birth?
Right. Within 12 hours of being born, the newborn needs to get two things. First, the initial dose of the hepatitis B vaccine itself. That starts the process of teaching the baby's immune system how to fight the virus. And second, they need a shot of something called HBIG.
HBIG. Yeah, that acronym sometimes confuses people. Can you break down the difference? What's the vaccine doing versus what's the HBIG doing? Are they the same?
Good question. Think of it like this. The vaccine is like the training manual for the baby's immune system army. It takes a little time for the body to learn and build its own defense. That's called active immunity. HBIG, on the other hand, is like bringing in immediate bodyguards or an emergency shield. See, HBIG contains ready-made antibodies against HPV, taken from donors with high antibody levels. This gives instant but temporary protection. We call that passive immunity. It's like a temporary wall to block the virus right away, while the vaccine starts that longer-term training process. You really need both for the best protection if there's been exposure at birth.
Okay, that makes sense. The immediate shield versus the long-term training. But that brings up a really common question we hear from parents. If the mother tested negative for Hep B during pregnancy, why the recommendation for the universal birth dose for all babies? Doesn't that seem like overkill sometimes?
It might seem that way, but it's really about creating a foolproof safety net. Look, testing isn't perfect. It can sometimes miss an infection acquired very late in pregnancy. Plus, the risk isn't only from the mother. An infection could potentially come from another family member, a caregiver, or even, as we discussed, from a contaminated surface the baby encounters. So the universal birth dose closes those potential gaps. Giving the vaccine right at birth means every single baby gets that baseline protection immediately, right when they are most vulnerable to developing that lifelong chronic infection, regardless of the mom's test results.
And the risk doesn't just stop in the delivery room, right? Even after they go home, unvaccinated kids face risks in everyday settings, like daycare comes to mind.
Oh, absolutely. Daycare environments inevitably mean close contact, little nips, bites, scrapes are common. If there's blood involved, even a tiny amount on a shared toy or from another child's cut, that's a real transmission risk for an unvaccinated child. That's why comprehensive prevention is so important.
Okay, let's talk about the solution then, the vaccine itself. You called it the training program. What exactly is in that shot they give the baby?
Yeah, what's interesting here is the technology. The hepatitis B vaccine isn't a live virus. It's actually what we call a recombinant vaccine. It contains just one tiny harmless piece of the virus, a protein from its outer surface. Think of it like showing the immune system a wanted poster of the virus without letting the actual bad guy in. This picture is enough for the immune system to learn to recognize the real threat and build its defenses, its antibodies. So the baby gets protected without any risk of getting the disease from the vaccine itself.
And what's the typical schedule for getting that full, lasting protection?
It's a standard 3-dose series for babies, and it's highly effective. The first shot is usually given right at birth. The second dose comes typically between 1 and 2 months old. And then the final dose is given somewhere between 6 and 18 months of age.
And once a baby completes that full series, how good is the protection? How long does it last?
It's remarkably effective. We're talking over 95% of babies who get all 3 doses are fully protected. And the duration is excellent. The protection lasts for at least 30 years, and very often it provides lifelong immunity.
Okay, we definitely need to address safety concerns head on because these are always, top of mind for parents. Is the hepatitis B vaccine safe for a brand new baby, literally hours old?
Yes, absolutely. It's definitively safe. This vaccine has been given safely to millions upon millions of newborns every year all around the world for decades now. The technology is very well understood, and the safety data is just vast and consistently reassuring.
What about side effects? What should parents typically expect, if anything?
Generally, any side effects are very mild and don't last long. The most common things parents might see are maybe a little bit of redness or soreness right where the shot was given. Sometimes a temporary low-grade fever can happen. But serious reactions are extremely rare.
And we absolutely have to tackle the big one, the fear that sometimes comes up linking vaccines, especially early ones, to autism. What does the science, the big studies, say specifically about the hepatitis B vaccine and autism?
You can be very clear and conclusive on this. Multiple, large-scale, high-quality studies involving hundreds of thousands, even millions of children have rigorously investigated this, and they have all definitively shown there is no link whatsoever between the hepatitis B vaccine and autism. That fear, while you might see it online, is simply not backed up by any credible scientific evidence. Parents can be completely confident about that.
Another concern I sometimes hear is about overloading a baby's immune system with vaccines, especially starting so early. Is that a valid worry with this first dose at birth?
That's a really persistent myth, but it's completely unfounded biologically. Let's talk about antigens. Those are the things that trigger an immune response. The number of antigens in the hepatitis B vaccine, and actually in the entire childhood vaccine schedule combined, is minuscule compared to what a baby encounters naturally every single day. I mean, just think about it. A baby's immune system deals with thousands, potentially millions of antigens daily, just from breathing, eating, touching things, encountering bacteria and viruses in their environment. The antigens in vaccines are like a tiny drop in that huge ocean. The vaccine doesn't overload the system at all. It precisely targets protection against specific dangerous diseases.
So this raises the really critical question then. What happens if the virus isn't prevented? If a child becomes one of that 90% who develop chronic infection? Because the information points out that these kids often look perfectly healthy, right? Even while the virus is doing damage silently inside.
That's exactly the insidious nature of chronic hepatitis B. It's a silent attacker working internally. The liver is a resilient organ, and it doesn't have many nerve endings, which means significant damage can happen over years, even decades, without causing any pain or obvious symptoms until things are very advanced, sometimes tragically so.
So the child feels okay, looks okay on the outside, but internally, what are the potential long-term serious complications down the road?
We're talking about really severe, life-altering liver problems. This includes progressive scarring of the liver, which is called cirrhosis. It can lead to liver failure, where the liver just stops working, potentially requiring a transplant. And, crucially, it dramatically increases the risk of developing liver cancer later in life. There can also be impacts on other systems, like kidney disease or inflammation of blood vessels. The harsh reality is that chronic hepatitis B absolutely can kill through either liver failure or liver cancer. And here's the most vital point. There is no cure for chronic hepatitis B. We have treatments that can help manage it, suppress the virus, slow down the damage. But prevention through vaccination is the only way to guarantee a cure because it stops the infection from ever taking hold.
That really reframes the vaccine, doesn't it? It's not just stopping a virus, it's actively preventing deadly diseases like liver cancer years later. The guide we looked at even called HBV vaccination an anti-cancer strategy.
That's exactly right. It's one of the most effective anti-cancer interventions we have. By preventing chronic hepatitis B infection in infancy and childhood, you are directly preventing the leading cause of liver cancer worldwide. It's truly a long-term investment in your child's future health, protecting them from a major cancer down the line.
So, connecting this back to everyday life, what does this mean for an unvaccinated child just going about their day? It sounds like they're carrying this invisible vulnerability into, well, pretty much everywhere.
They really are. Routine childhood activities suddenly carry a hidden risk. Playing contact sports becomes riskier because of the potential for scrapes, cuts, blood exposure. School environments with lots of kids close together present risks through shared items, occasional fights, or accidents. Even at home, if anyone else in the household were unknowingly infected, sharing things like toothbrushes, nail clippers, or razors could potentially transmit the virus. The vaccine essentially removes that constant low-level background threat.
Okay, let's try to bring this all together then. Hepatitis B. It's silent, it's highly contagious, it can be deadly. But the crucial takeaway is that it's also completely preventable.
That's the bottom line. When parents follow the recommended vaccine schedule, especially getting that critical birth dose, they are essentially giving their child a lifelong shield. They're protecting them from potentially decades of chronic illness, cirrhosis, liver failure, and cancer. So maybe just consider this as a final thought. Knowing that this virus can survive on a doorknob or a toy for a full week, and knowing that an infant faces a 90% chance of lifelong, potentially fatal disease if infected at birth, how does that change your perspective on the value of acting immediately? The data strongly supports universal early prevention like the birth dose. It just makes sense.
If this conversation has sparked more specific questions for you about protecting your child, or if you're looking for reliable, expert-backed information on pediatric health topics, we really encourage you to visit omegapediatrics.com. That's OMEGA pediatrics.com. And if this deep dive helped clarify things for you, gave you those core facts you needed, please do remember to like the video, subscribe to the channel so you don't miss our future explorations, and maybe share this video with other parents or caregivers who might find it useful. Thank you so much for joining us for this really important discussion. We hope this knowledge serves you well.
Goodbye for now.